Hi everyone, my name is Janis Slezins. I'm a board-certified neurosurgeon practicing in Riga, Latvia. Today I want to discuss with you one very interesting condition called idiopathic intracranial hypertension. So, idiopathic intracranial hypertension, also known as pseudotumor cerebri, is a condition which is characterized by elevated intracranial pressure, which means pressure inside the skull. And there is no obvious cause to this elevated pressure. So there is no tumor, there is no other disease that cause higher pressure inside the skull. So if there is a situation when someone has higher pressure inside the skull and for no other reason, it is a condition called idiopathic intracranial hypertension. Most oftenly affected by this condition are overweight women at childbearing age. However, this disease can be present in other groups of patients as well. And as regard to symptoms, since main characteristic of the disease is elevated pressure inside the skull, naturally the main symptom of the disease is headaches. The second most common symptom is some kind of eye or vision related. Since optic nerve is the most sensitive structure to elevated pressure inside the skull, these patients start to experience some blurred vision. Sometimes they start to lose peripheric vision. So the visual acuity stays the same, so they kind of see the same. They don't even notice that they start to lose the whole field. For example, typically these patients become quite dangerous on the streets because they cannot see, once they try to cross the street, they cannot see the vehicle approaching because they have lost the peripheric vision. Returning back to headaches, these headaches can radiate also to neck or even lower down to back. And also sometimes these patients experience some kind of pulsatile ringing inside the head, which is called tinnitus. And as we already know, optic nerve is the most sensitive structure. If this condition becomes untreated, it can progress to complete blindness. How to establish diagnosis? So if there is a patient presenting to doctor's office with typical complaints of headaches and some visual disturbances, it's important to do an MRI scan or in worst case scenario CT scan to rule out any possible underlying disease like tumor. If CT and MRI are negative for other explanations of the symptoms, CSF tap or lumbar tap needs to be performed to measure intracranial pressure. Since fluid spaces inside the skull are connected to those inside the spine, if we perform lumbar puncture or spinal tap, we can measure the pressure, and the pressure will be equal in spine and head. So if the pressure is elevated, we can confirm the diagnosis of idiopathic intracranial hypertension. And now about the treatment. If disease is very mild, so intracranial pressure is just slightly above the normal or just borderline, we can start treating patient with the medication, which is diuretic medication called acetylamide, and losing of the weight if there is excessive weight on the patient. If the disease is immediately severe with very high numbers of intracranial pressure, we need to treat patients surgically, a procedure called CSF diversion, basically which means implanting a device that is draining excessive fluid from the skull and therefore lowering intracranial pressure. The last thing I want to stress is early diagnosis is very important, as if this disease stays untreated, the consequences are quite severe in form of complete blindness. And vice versa, prognosis is very good if this condition is detected early and treated.